Stereotactic surgeries. Stereotactic surgery is a minimally invasive form of surgical intervention which makes use of three-dimensional coordinates to locate small targets inside the brain and to perform some action on them. Stereotactic in Greek means movement in space. Historical background. Stereotactic surgery was first developed by two British scientists in 1908, that is by Sir Victor Horsley and Robert H. Clark. It was designed as an apparatus to study the cerebral function in the monkey. Anatomical points inside the brain as the pineal gland were used as reference. The method presently uses image-guided surgery. Applications of stereotactic surgery in biopsy, precise tissue sampling with minimal brain damage, surgical treatment of Parkinson's disease, deep brain stimulation, brain abscess aspirations, tumor resection, vascular malformations, localization. Draining of hematomas, functional neurosurgery such as epilepsy, stereotactic radiosurgeries, and radiotherapy. Disadvantages of stereotactic surgery. The frame-based systems are bulky and uncomfortable for the patient. It obstructs the operative field. It does not offer real-time feedback. It is time-consuming. It is a blind surgical procedure. It obstructs access to airway for anesthesiologists, infections caused by pinholes in the skull, lack of correspondence in the coordinate system of the stereotactic frame to the patient's brain coordinate system. Types of stereotactic frame systems. The first one is translational or the orthogonal system, the arc system, the burr hole mounted, and the interlocking arcs. Arc quadrant systems. The principle states that the probes are directed perpendicular to the tangent of an arc which rotates about the vertical axis and a quadrant which rotates about the horizontal axis. The probe is directed to a depth equal to the radius of the sphere defined by arc quadrant will always arrive at the center or the focal point of that sphere. Procedure. The stereotactic equipment for fixation of the patient consists of the following: the head ring, fixing posts, fixing pins. The open stereotactic system is designed to be used in CT scan and MRI. The open ring is made up of high-tech ceramics which gives excellent mechanical stability and MRI compatibility. A Cartesian coordinate system specifies each point uniquely in a plane by a pair of numerical coordinates which are signed distances from the point to a fixed perpendicular lines measured in the same unit of length. The scalp is infiltrated with local anesthesia at 4 points. The base ring is then attached to the patient's skull with 4 pins. The localizing ring is then attached to the base ring. CT scan of the head is done. The image obtained in conjunction with the localizing ring allows the neurosurgeon to compute the exact 3D position of the region of interest by the intersection of two projections. The entry point and the line in 3D space is calculated by vectorial equation. The patient is brought to the operating room. The frame is fixed to the operating table with the head only slightly elevated above the chest. A small patch of hair is shaved over the appropriate region.